Good evening and thank you for coming. It's taken a bit of time in the making, this strategy, but I'm delighted that we're here at last to launch it. Unfortunately, Tom Binney, the Health Minister, is unable to be here. He's not well. He's stuck in England because he's not well and he can't travel. But I'm very, very pleased to say that Deputy Andy Howe, one of our Assistant Health Ministers, has come at a very last minute notice to represent him, and we'll say a few words. And then you'll hear about the detail of how we develop the strategy and what's in it. And I'll talk a little bit at the end about what we're going to do next and how we implement it. Because as with all of these things, the risk is that what we end up with is a nice shiny brochure that looks nice and says the right words but doesn't actually translate into anything. And that's the last thing that we want this to be. We want this to be something that is meaningful and important. So I'll talk a bit about that. One of the things that I absolutely want to say from the beginning, and it's reflected in the ministerial forward in the strategy, is about the collaboration that's gone into developing this strategy. It's been jointly led by the Government of Jersey and by Autism Jersey, but that's just the beginning of it. Actually, we've had loads of people from loads of different organisations involved. There were multiple stakeholder events, as you'll hear, where lots of different people came and talked about their experiences and their ideas and what mattered, what should we prioritise. And that collaboration, I think, has made this 100 times better than it would have been without it. But crucially, it's the only way that we're going to deliver it. What you're about to hear is a lot of work, actually. There's a lot of stuff to do, and it's way beyond the remit of any one individual or organisation. It's going to take real collective collaboration to get us to where we need to get to. But I'm confident, having seen how we've got this far, that's what's going to happen next. So I'm really sure that that's going to happen. And we need to do more than just create awareness. You'll hear about awareness and training, but it can't just be that. We also have to have some actions where we actually pin down what are we going to do and how are we going to do it and how do we know whether or not we've done it. That's important, isn't it, in terms of implementation. But in the end, this is all about making Jersey more neuro-inclusive. It's about bringing people together and creating a place where people are able to thrive and prosper and be their best and contribute their best. And we know from the stuff that we've heard that sometimes that is not how people experience life here currently. So that's one of the things that we simply have to change.
So I've come to say thank you all tonight for coming. And this is so important for Jersey because we're recognising that we're not all the same. We're not all we're all different, and we should embrace those differences and really make sure that we work together, all of us, collaboratively. And I want to say thank you so much for everyone who's had an input in this. And as Andy, Deputy Andy Weary said, that we're all going to want to have action and to make it a really inclusive island for everyone. And thank you all.
My name's Leslie Harrison and I'm Head of Charitable Services at Autism Jersey. And this is my colleague. I was going to say partner in crime, but I can see Mr. Cutland from probation sitting in the front. Liz is Health and Community Care Services. Now, this is very much a journey that we've all been on, and the journey is not finished. This is really just the beginning. It's already been highlighted by Andy about the collaboration and how important that has been. Everybody in this room, there's so many people here that we know have had a voice, that have contributed, should that be in roadshows or different activities, that have helped us to get to this stage. So now what we need to do is to build on some foundations that we've already got and take it further so we can keep this moving feast on the go with good outcomes. So the survey, the strategy itself, was based on data and information that was collected over a 4-month period from over 500 islanders who contributed to our work. Now, what we did was we combined qualitative and quantitative feedback. We then analysed the data in order to ensure that we had a well-rounded approach and presented our findings back through stakeholder group engagement. And that's the real key. We needed to make sure that we were understanding what we were being told and we were recording it in the right way. Information was gathered through a mix of survey interviews and also engagement groups. A steering group was established to oversee the development of the strategy, And this 11-strong group is comprised of a mix of people with lived experience and service and charity professionals. The collaboration being key for shaping a practical and responsive strategy. So I really like the two Ronnies, only a bit more attractive.
So as you'll see, we had lots of respondents, and that was amazing for us. We almost had to pinch ourselves at times. So 460 people contributed to the survey, which is no mean feat because it did take a long time to fill in. And I'm testament that I took the time to do it myself, so it was a bit of a feast. But it gave us a really sense of people's experiences of living and working and having family life here in Jersey. And then we went off on our travels around the island. So we went to the north, south and east and the west parishes, and we had some parish roadshows which were really well attended by lots of different islanders and some really interesting conversations. And again, people wanting to participate, share their stories and really get involved in shaping the strategy on our behalf. And then we had 24 people who contributed through the autism and service scoping sessions. And that was about us testing out what's happening, what's going on, some pockets of amazing work and how we can find out how to build on that. And it really helped us to understand what's working, what's missing and where services needed to evolve. So then we analysed our results. So we wanted to make sure that the findings were robust. We validated the data using several tools and several people looking at the data alongside us. We triangulated the information from different sources, the survey responses and the stakeholder feedback, the engagement sessions, which was so rich. And we checked all of that information for consistency and depth. Then we carried out a thematic analysis to draw on the key patterns, the priorities and the shared experiences that everybody offered, and that helped us to shape the strategy as it is today. So in summary, we wanted to make sure the strategy isn't just a document, it's something that's actively reviewed and accountable. So we built a measurable outcomes and a yearly review of performance, which will be reported back to stakeholders, people in the room, at regular intervals. The steering group will continue its really important work and will lead the actions of the strategy. And we want to create a neurodivergent advisory board, which will hold us to account. And there will be people on that committee who will provide lived experience, insight. They'll sense check our work and make sure that we stay true to our actions.
Thank you very much. So when it came to the findings and the recommendations, this outlines the key findings and recommendations for the identified strategic themes, each of which sets out priorities for the next 3 years. The latter are organised according to the importance of the ratings given by survey participants in the responses and also in in-person meetings. Waiting times and diagnosis alongside training are the top themes in this report. Other findings highlighted themes that are important for all neurodivergent individuals to help them succeed. Integrated approaches are essential to ensure that neurodivergent individuals receive support in all aspects of life, enabling their health and well-being to thrive. So this is the top line, data. Now we want to look at what those strategic priorities actually are and the 7 themes. And it goes right the way. If you think about it, common sense would say, okay, where are there going to be the most challenges? And you're looking at in healthcare, employment, education, etc. But this work that was undertaken identified these 7 priorities, but it meant that we have 24 associated actions within the strategy. Andy's already alluded, we don't want to have a strategy that's a nice shiny document that's going to sit on a shelf. We want to have something that's realistic, accessible, and gives us the opportunity to implement and influence change, that we are genuinely going to have some positive outcomes. And that can only be done in a timely manner. It's a 3-year strategy, but one that'll be continually reviewed and refreshed to meet the needs as they change. It's interesting though, training and awareness, which is our 7th theme, that actually flows right the way through every single priority that we have identified through this report. So whenever we start looking into details in terms of what our actions actually are, priority 1 being healthcare, addressing the healthcare needs of neurodivergent individuals in meaningful ways. We seek to give enhanced healthcare professional training to increase neurodivergent awareness and understanding so that they're actually able to give empathetic care tailored to suit individual needs. Early and accurate identification of conditions such as ADHD and ASD being a priority. We are dedicated to expanding and improving access to assessment and diagnostic services in order to reduce delays and barriers. In light of the mental health challenges many neurodivergent individuals face, we will seek to improve access to specialist mental health services that address specific ND needs. Equitable access to mainstream health services are being essential. So what we need to do is we actually need to work together to remove the barriers that prevent ND individuals from receiving the care that they need. Acknowledging the healthcare needs that they may face, but we're committed to implementing reasonable adjustments to ensure they can effectively access general health and social care provision. Now, in focusing in these areas, we seek to create an inclusive, accessible and responsive healthcare system that ensures better ND health outcomes and overall well-being. So next, if we look at priority 2, which is employment, we're committed to fostering a supportive and inclusive environment for individuals and employers alike. We seek to address the significant gaps in awareness across all stages of the employee life cycle by providing comprehensive training, guidance and resources to employers, service providers and also to employees. Our focus lies on cultivating inclusive recruitment practices from the onset, attracting, recruiting and keeping talent while paying particular attention to onboarding policies and procedures. Therefore, we hope that ND employees will receive the support and accommodation they require throughout their careers. Actions include providing targeted training to raise awareness and inclusive practices for employers, employees and service providers, informing employers about relevant legislation and protected characteristics, ensuring that they understand, but also that it doesn't become a tick box exercise, that you genuinely have policies and procedures that are in line with legislation, but are inclusive and recognise everybody's individual needs. We want to ensure that there are support systems that are going to give greater access to employment for neurodiverse individuals. We want to encourage employers to implement reasonable adjustments, but also develop an employment charter that will guarantee their commitment to inclusion and support for ND staff in all levels. We've already started a lot of work and laid some of the foundations with regard to working with employers, looking at toolkits for employers, looking at a transition to employment. So a lot of work's already started to happen, and collectively the groups will all start to come together to deliver some of this work. Our mission is genuinely to create a truly inclusive and supportive workplace from which employers and employees alike can actually thrive and survive. So, education is priority number 3. And again, we're committed to challenging current systems to ensure education better meets the needs of neurodiverse individuals. We're dedicated to enhancing teaching approaches and teacher training so that adaptive teaching yields appropriate inclusive practices across all schools and all educational settings. ND students, especially those who have ASD, ADHD or dyslexia, often experience inadequate support, resulting in poorer outcomes. Further ongoing training across the education system will promote and develop skills to better support those students. Flexible learning approaches can be implemented to blend learning models, for example, the combinations of looking at home education, classroom, community, and therefore reduce anxiety. Tailored learning plans will reflect the needs of neurodiverse students, Peer and mentoring support programs may inspire and address the inclusion of these individuals. Greater focus will be placed on reducing not in education, employment or training, NEET, with targeted interventions. Education should embrace behaviour-based communication, focusing on support rather than exclusion, and communicating in a timely manner for assessments and early intervention, and improving links to mental health and mainstream health services. Targeted plans, pathway to adulthood, should support that transition from school to adulthood. Neuroaffirming practices signify belief in a strengths-based and rights-based approach to developmental differences within the goal of providing support and adaptations that affirm neurodiverse identity. Next, we have priority number 4, the criminal justice system. We are committed, and right the way throughout each of these priorities, we are absolutely committed to delivering. We're committed to supporting neurodiverse individuals within Jersey's criminal justice system, as they can often face significant challenges across healthcare, education, employment, within a prison environment. Reported healthcare struggles at the prison in particular included inconsistent medication management, changes without consent, and a limited psychiatric and psychological support. Community healthcare services are hampered by lengthy diagnostic waiting times, inadequate pre- and post-diagnostic care, and insufficient understanding of neurodiversity amongst some medical professions. Educational opportunities within custody are experienced as being restricted by limited course offerings and a lack of rehabilitation-focused strategies. They are compounded by systematic issues such as a history of educational exclusion, punitive responses to behavioural challenges, and deficient strength-based learning support. Employment factors highlight the importance of that skills-based job matching, structured routines, and neuroaffirming behavioural placements. However, in the prison environment, neurodiverse individuals may experience mechanisms that are inconsistent due to the lack of understanding in terms of staff and also their approaches to management. And of course, inadequate sensory regulation because, of course, it's a prison environment. Reasonable adjustments such as screening and support during police interviews or probation during legal proceedings can often be absent. Addressing these issues require comprehensive training for employees, robust screening for neurodiverse conditions, personalised educational and vocational programmes, and focused prison health initiatives. Consideration of interview methodologies and improved communication across the criminal justice system is also quite key to successful outcomes in that environment.
So another key part of making the strategy work is looking at how public services work and making them genuinely accessible for neurodiverse people. To do that, we're establishing, as I spoke about earlier, an advisory group that can guide services to better understand and respond to each individual's needs. Alongside that, we're developing training and support, including peer mentoring and advocacy, so staff have the confidence, knowledge and lived experience insight to make accessibility a part of everyday practice. Also, supporting family and carers is something we're super passionate about. It's a vital part of this strategy. We're going to develop an in-person hub where people can access advice, guidance and connection with the aim of reducing stigma and shift conversations about neurodiversity towards a strengths-based approach. Training and awareness sessions, peer mentoring will also be central, ensuring families and carers feel supported, informed and part of the wider neuroinclusive community. And then finally, our last action is training and awareness. And as you'll notice, it's flowed through all of our actions, and it's a really important part of the work that we want to achieve in the next 3 years. So we're looking at what training and awareness already exist in our community, and there's partners in this room who are already delivering really important training to individuals, to young people, and supporting people through awareness for neurodivergent conditions. We want to enhance that, but we also want to understand what's working and how we can work together around driving the training and awareness agenda. So we're looking at public services, local businesses and third sectors to join us in this quest. By understanding what's out there, we can build on what's working and fill in the gaps together. The aim is to develop a shared neurodiversity training that's accessible to everybody, supported by peer mentoring and advocacy, so that understanding and inclusion become a part of everyday life in Jersey. Thank you very much.
So I'm hoping there's not stuff there that people will have thought, oh no, that doesn't sound right, given the amount of work that we've done to get to these priorities. One of the things I do want to say is that invariably when you go out and ask people to talk about things that aren't working well and things that could be better, what you hear about is things that aren't working well and things that could be better. We also must acknowledge that there's a vast amount of really good work that goes on in Jersey in this space currently, and we need to build on that. This is not a strategy that says everything that we're doing now is dreadful, chuck it all away and start again. That's not this. This is about saying there's some really good stuff happening, but we need to do more of it, we need to be more consistent, and really we particularly need to bring it together so we're making the best use of the resources that we've got. So what are we going to do? What happens next? So we are going to re-establish the project board that oversaw the development of the strategy. And most of the people that were on that board will stay with it, I hope, and will have responsibility for implementing the words in this document. And then there's a few other folk that we're going to ask to join us because we think we need to make sure that we've got good representation from each of those priority areas. There's a trick there, in that what we'll then do is say to the people around the table, what we now need is a named person to lead each of those priority areas, because there's a lot of work in here. And it's not going to be done by one or two people. But it gives responsibility and it allows people to go off and do the work and come back to us in the project board and say, this is what I'm doing. Then we need to prioritise. Because there's a lot of work in there, this is a 3-year strategy. We're not going to do everything in year 1, but also some of the pieces of work are huge. So reviewing employment law and potentially making changes to that, that's a huge piece of work that's going to require engagement from law officers, potentially law drafting, going out and doing more consultation. You know, it's 3 or 4 words in this document, but the amount of work that's required to do it is vast. Likewise, making healthcare services accessible. When you start to list the number of healthcare services that we've got, and then think about now how we're going to start determining which of those we work with first, that's a huge piece of work. Looking at all of the steps of the criminal justice system, that's a huge piece of work. So we need to be clear on the off about this is what we're going to do in year 1, this is how we're going to do it, and particularly this is how we're going to measure whether it's making any difference. So for each of those priorities, there must be something that says this is our measure, this is how we'll know that we've set out to do something, firstly that we've done it, but then secondly, has it actually done what we wanted it to do, what people asked us to do? That's terribly important, I think. So we need to understand what have we achieved and how. There's some challenges in this. The first one is we feel a little bit awash with strategies at the moment. I went to meet with a group of people that use mental health services last week to talk to them about we're developing a mental health strategy. And the first thing that someone said in the group was, here he comes again, let's guess, you're developing another bloody strategy. And I thought, she's right, actually, that's quite good feedback. Here we are again asking you about this because we, and what does that mean to people? So we also need to think about then, how do we prioritise implementation of work across all of these strategies? Because we've got a finite resource and we've certainly got a finite amount of money. So what does that mean? And how can we bring stuff together? Are there areas where we could be working on more than one piece, but just doing one piece of work? I think there is. So I think that's that. Training is a particular issue. All of the strategies that we currently have say we're going to train all of our staff in X. Now there's a problem with that. Who's going to do all of this training across all of these strategies, and how are we going to release everybody to do all of this training? How's that going to work? So we need a very honest, practical conversation about actually if we really want to train everybody in 3 things over a 3-year period, what does that look like? How many people? What resource do we need? And how do we make that happen? And that stuff doesn't happen by magic. That requires a lot of work. And there's no magic wands and there's no pots of gold. And they're the real challenges in terms of delivering this type of strategy. Because it'd be great if we had a big bucket of money and we could say this is what we're going to do to implement this, but we haven't. That's the reality. So we have to make some prioritisation decisions about what are we going to do and in what order. And that's just the reality, I'm afraid. But the work to date demonstrates that we can produce a lot in a relatively short space of time and to a good quality. So that makes me believe that we can do this. We can make it work, but it's going to be a lot of hard work. There's some really good stuff that's already going on that we can absolutely build on. So I was talking yesterday to the Chief Officer for SIPES, who was talking about the work that they're doing around trying to reduce exclusion. One of our specific objectives is reducing exclusion for neurodivergent children in schools. We can just build on that work. We don't need to start another piece of work. We can build on the work that they're already doing and provide it with a bit of additional focus, I think. I was at the prison yesterday meeting the new prison governor, and I was hearing from the staff they're doing some really good work around neurodiversity there, and they've got some really good ideas about what they want to do differently and how they might just make some minor adaptations that could make a difference. We can build on that. And I had one of the lead nurses come to see me today, by coincidence, to talk about the fact that they're a bit worried about neurodivergent young people turning up in A&E and how that's working and whether or not they're getting the best care offer that they might, and are there things that they could do to adapt that. And I thought this, and we were laughing about the fact that I was coming here this evening and talking about this. And I said, this is a really good example of something that's coming from that team. It's not coming from us and our strategy, it's from that team saying this is something we think we could do differently. How can we do it? That's great. So there's loads of opportunity. You've heard then that the other thing that we'll do, and this is learning from implementing other things here, is that we will produce an annual report. And that's really important. The amount of effort that's gone into producing this from lots of people, it's only right that we should be regularly coming back and saying this is what we've done, this is what we haven't done, this is what we're going to do next, because that also helps hold us to account. It means that publicly people can say, well, you said you were going to do those things over 3 years and you haven't done any of them, why not? And that's important, I think. So it doesn't just become another nice glossy brochure that sits on shelves everywhere and doesn't mean anything. So that's how we're going to move forward, and that's how we're going to make the work happen. And as you've heard already, you know, our real ask is for involvement. We need people to be involved in this work. And if we create an army of people that are absolutely dedicated to delivering this, then I've got absolutely no doubt at all that we can make some real change here. And that's what this strategy needs to do. So over to you then. Do you have questions? Are there things that you've heard? Yeah.
Hi, I'm Summerton. I represent also autism. Andy, just to build on what you said, there's a lot of good stuff happening in Jersey at the moment. But I was just thinking, has there been any thoughts around maybe linking in with people that are maybe a few years ahead of us, like the Scottish board and UK boards, where they have similar strategies, and I've read them both, and actually there's probably 80% similarity because we all face the same challenges. Yeah. And I just wondered, is there any plan to link in? Because whilst it'll be maintaining and building on some of what's already there, as you say, but there'll be some new initiatives, and it could be really advantageous if we did that, I think, because it would save a lot of time.
Yeah, totally agree. In the development of the strategy, there was a bit of that, wasn't there? People went off and spoke to other places. If you look at the London strategy, you'll see the format of our strategy is quite similar to that. That's deliberate. It's because we looked at lots of strategies and we said we really like that one. We like the way it's laid out. It makes sense. So you're dead right. We need to go out and about, and when people are identified to lead the pieces of work, they will have absolute free rein to say, this is how I want to do it. So yes, thank you. It's helpful, Samantha.
It might be a private conversation afterwards, but is there any what scope is there for sensory health services within there, from children through to adults?
So I imagine that would sit in one of the priority areas. I imagine that's probably the health/education, and that's actually prompted me to say that one of the things we need to watch is that we don't end up with 7 siloed pieces of work that don't speak to each other. Although we've got these 7 priorities and there'll be 7 work streams, actually they do need to communicate, and there will be some stuff that works across. So I think that's where that conversation will take place about what's again available to us that can help us implement some of this to make the difference.
Why is neurodiversity employment law different from ordinary employment law?
We're not sure it is.
It's not, it's a protected characteristic. Jersey was a little bit behind Guernsey whenever it came to implementing some legislation, but we introduced, like, in different stages, race, religion, sex, etc. So the legislation is there as a protective characteristic to make sure that everybody in their appropriate area is treated with the utmost respect and dignity and in line with what is best practice as well as legislation.
So everybody's the same?
Everybody's needs are different. We're all individuals, aren't we? So everybody's needs are different. But you have to recognise that certain characteristics need to have that protection in legislation in order to thrive and survive. And that's a good thing, John. It's a really positive thing, without a doubt. So it doesn't matter, if I, for example, if I was dyslexic, I'd like to think that my employer at Autism Jersey, if I spoke to them, what do you need to do your job successfully? What support can we give to you? Not everything costs money. There's some very minor things that can actually be done to make sure that people are included and can work more effectively. So it is positive.
I think the intent, John, is to make sure that inequalities are addressed within law where required, so that actually so they're thought about.
It applies, isn't it, across the whole spectrum of all people, all employees, really, whether it's recognised or not hitherto recognised.
Absolutely.
It's the same for everybody, which is fine.
Yes, I think it's about making sure that our legislation, our employment law, recognises and takes into account inequalities and difference. That's the issue, I think.
So can I ask, what made you look at ASD and ADHD within the prison? What prompted that?
Yeah.
The feedback that we had in the workshops, we did some workshops in the prison, and because it's a controlled environment, it's quite challenging. You can imagine all the permutations of trying to operate within a prison environment and the restrictions that go with it.
Mm-hmm.
And it's trying to ensure that everybody has access and equal opportunity to learn and develop and address that balance between retribution and rehabilitation. That's really quite important.
But also
Many people came through the research that we undertook and spoke to within the prison environment actually transpired that they just happen to have a high population of neurodivergent individuals, and many perhaps coming through a system where their home life may not have been good, they didn't have the opportunity to have education, there were other issues in the home environment or socially for them, and that was impacting and exacerbating some of those anxieties that they would have in that situation.
And are you hoping that now that that's been taken on board, that the justice system will be not as busy?
I think already we've seen lots of really positive work that's been going on, lots of collaboration between probation and aftercare services, police, prison, etc., collaborating to make sure that if you've got one individual that's going right the way through the system, because don't forget they're coming in through the police door to start with, then they're being processed, they're going into a custodial environment within the prison, and then they're going to come out the other end, perhaps under probation and aftercare services. So it's really quite important that everybody understands individuals' needs, have got the right level of training, and can address that right level of support. And the work that Liz did, Liz went up, you did some workshops at the prison, you might be able to elaborate on that, Liz, from your experience.
Yeah, I mean, I think UK research says that quite a high proportion of offenders do have a neurodivergence as well, and so we do need to really look at that kind of cohort of people at Illinois as well as the general population. So it's something that we need to understand more, and we need to really target some of those individuals.
Okay, and what about supporting the families who've gone through that process?
The prison and probation, they do support the family. So you've got that whole holistic approach in terms of how they rehabilitate someone. It's not just a case of giving somebody an education, giving them a skill, etc. You've got to address all of those things that impact on how they got into that situation in the first place. And family life is quite important.
What about the families who's gone and supported their one who's gone through that system and hasn't had that support themselves?
Well, that's what it all has to join up. So you'll find a lot of collaboration, certainly with external agencies and different partners across government to make sure that the families do have support. People aren't isolated in prison and have got no access. It's recognising that they need to have a home to go to, they need to have a roof over their head, they need to have relationships, whatever that relationship and that dynamic might look like. So that support for families is equally as important as the support, I think, for prisoners.
Yeah,
Sorry?
if I may just say, I think what's really important is picking up those things. When we actually develop the working groups around each thing, there is an opportunity to come in and be a part of that working. So, look out for that opportunity, because I think that's the place. It's beyond tonight that we can pick up those particular details.
And Mr. Cutland's got some
Can I just come in?
feedback.
Thank you very much for your question. I work for the probation service, and I really welcome this evening's presentation and the strategy, because I think it's fair to say we're all developing understanding of neurodiversity. So in the service I work in, we have some colleagues who are neurodiverse, and we've realised over the years that we're picking up young people who perhaps haven't had the best experiences of education. They don't feel included. Their educational capacity to learn, to achieve has been compromised. And then it's a bit of a turbulent trajectory, if you like, into getting into a little bit of trouble. But once people come into the criminal justice system, the challenge is to understand why people may behave like they do, to understand that better, to increase awareness, and then adapt services to meet those needs. And I think what we're seeing today is that we're starting to do that. It would be a complacent and rather naive society that says that we've got this covered. We are continuing to learn, and I think there's a challenge for us as employers to accommodate, to really welcome neurodiverse colleagues. I think they bring a wealth of experience, of skill, of insight that we will be plain daft to ignore. And I hope that awareness and spirit of being inclusive will have an impact on criminal justice, because, as Liz says, we are seeing and we've experienced too many neurodiverse people unable to cope with the criminal justice system and end up in prison. So it's a challenge that we absolutely need to grasp. So I really welcome your question and insight.
And I think there are two interventions. One is, where do we build on things that are already there and make them more accessible? So are we likely to develop a support group for relatives who have a relative in prison who is neurodiverse? Probably not, actually. We should be expanding support groups for people that are in prison to make sure that they are accessible and available to people who are neurodiverse and their relatives. So what we don't want to do is set up a whole parallel world over here for people that are neurodiverse, because that's not going to work for all of the reasons that are obvious, frankly. But your original question was really interesting. Is it going to make the criminal justice system less busy? Because if we think that part of managing reoffending is people go into prison and engage in offending work, what we've heard from people in the prison is that they really struggle to engage in some of that offending work because it's not accessible, it's not done in a way that they can relate to, it doesn't take into account their individual needs, so therefore it's not going to work. If we address some of that in the end, wouldn't it be a great aspiration to say actually one of the things that might happen at the end of all of this is it might actually reduce reoffending? Now we're not going to be bold enough to say that, but that could be an outcome, and I think that that's what we should be aiming for.
And is it something you would probably follow through and study? And
Yes, absolutely. That comes back to the point of we need to demonstrate what is what we're doing working. You know, has it made a difference? And one of the ways that we would measure in the criminal justice system our interventions is by whether or not we reduce people going back into it, frankly. There was someone over here. Yeah.
So, as a neurodivergent individual, I've struggled. Like, I'm in my 70s, so it wasn't really a thing. And as I've gone through life and learned things like, so I discovered ADHD Jersey, and amazing. I've never felt so part of anything. And just going to what you're saying, so I feel, I'm not being biased, that we have a health system that is at capacity. We don't have finances. So people like Jersey, ADHD, mind, will you be using them as a stepping stone? Because if I wanted to speak to someone, I'd have to go to my GP, or if I wanted to, wait to see someone within mental health. But these people are there all the time, can phone up and say, I'm having a really bad day. Today could be a great day. 2 days later, I could be having a bad day. And I can't get into that system straight away. So I just wondered what's going to be happening with the sort of organisations outside.
So you'll notice through the strategy we talked loads about peers and advocacy, and I think out of all the people that we've spoken to, we've found people with lived experience find their allies, and that is their circle of support. Health, public services, they're all part of the picture, but it's about the belonging and the community.
I'd love to feel that I could give back what I did.
Absolutely.
And I'm very passionate about it.
And I think once with lived experience, you have that unique view of supporting a person without judgment, and I think that's where we need to, and actually, that I think that we're doing that already, and I think there's so many great examples of really good peer support work going on, but I think we probably need to formalise it or think about how we collectively work in that way. And that's evidence-based, and there's training around that, and all of those sorts of things. So I think, for me, I'm passionate about, lived experience and how we can get people to really support other people who might be a little bit further down the line or, need that additional support. Like you say, it's not, you can't wait for an appointment, you can't wait to speak to your doctor, you sometimes just need advice. Does this feel real to you? Is this right? And I think that that's where the community can really galvanise around each other, and I have my allies, most of them are in this room, and and I wouldn't be able to do what I do without that. So I think that's back. We've written it in the strategy, but it's back to us as a group to really see how we can put that on steroids.
And we need to commission it. We need to pay for it.
Absolutely.
Because the reality, you're absolutely right, services are stretched, there's a finite resource, we need to make sure that we've got the right people doing the right thing. And often statutory services want to do everything, and a lot of the time there's a lot of stuff that other people do better, and we need to say no, that's not us actually. And we've started to see some of that. We've got examples we've recently relet the carer support contract, for example, in a different way, because we want something different. We need to be clear from a government perspective about what we're wanting, what we're prepared to pay for, but we need to then go out and talk to people about how do we develop this. We don't have all the answers. So I think you're absolutely on the money.
This is amazing, and it is really means a lot, I think, for us, and it's like, I think, well done to everybody.
It's yours, so
this is genuinely, it's a strategy for the community, by the community. We can do all this on a Romeo, you know. We had everybody who come together, and I see so many people in this room and had an active role to play into doing this. But then getting to the next stage that Andy's talked about, you know, with regard to implementation, you've all got the opportunity, come to the table and be part of it and help influence and implement that change. It can only be a good thing. There's a lot of really good stuff that's being done, a lot of good stuff going on. We've still got a bit of a journey to go, but it's always going to be like that. It's always going to be a moving feast, isn't it?
So as far as the next steps are concerned, is it that board that will consider how to even just start implementing?
Absolutely that. And we reconvene the board and we get people together and say, right, how are we going to prioritise, how are we going to work out what we do next year, and then start getting the work happening.
We talk about funds and, you know, money. Obviously it's a big topic. You know, this week we've obviously had the SEN report that went out. Obviously there's other findings there that need to be done with and dealt with. Where will this money come with? You know, will this just stay on bits of paper and not actually elaborate to anything? No. You know, because we're seeing children struggle as we struggled as adults in the classroom. Yeah. So when are we going to see that change? There is pockets of change, but just little bits.
Yeah, so the money question is so difficult, isn't it? Mm-hmm. And the Health Minister has set out the priorities for next year in terms of investment. We've got multiple strategies that require some investment. We have to start with, are we using our resources today to the best of our ability? Are we efficient in the things that we do? Can we redesign? So we're doing a piece of work at the moment around the dementia pathway, which the dementia strategy was published, and we've said one of the things we need to do is that we need to have a new dementia pathway. On the back of a fag packet, my reckoning is that the model that's being proposed, we could do about half of it within our current resource and make a difference. But the other half, we're either going to have to take money from somewhere else, and that's a priority conversation. And that's, you know, these are real conversations in any health and social care service anywhere in the world at the moment. There's all this demand and it's growing and growing and growing. We've got ageing populations. It's great, people are living longer, but there's a health and social care cost of that actually. So, you know, we will have to make some decisions about prioritisation. And now, if I asked you all to vote today, where should we put the money? You know, I imagine most of you would say in this strategy, because of course, but if I was standing in front of a group of people that were there to talk about the dementia strategy, they would say the same thing. And when we do the mental health strategy, they would say the same thing, and. So there's just some difficult, honest conversations that we need to have moving forward about, this is the resource, how do we carve it up?
Can I just add something as well on that note? Because this strategy, it's no different from any other strategy. As Andy says, there's not a big pot of money somewhere, but it's not all down to government. And this is a collaboration between public, private and third sector. We all bring something to the table. We've all got access to support, money, grants, etc. We can make some of these things happen. You can see quite clearly whenever you start looking at some of the detail in that strategy, there's some really quick wins in there, and there could be things that are little to no cost, maybe looking at systems and processes, small amounts of money, things I highlighted, we're working on as a group with for a toolkit for employers, a Neuroinclusive toolkit, and do the same for employees. But we're bringing this to the table because we're all collaborating. It's in line with this strategy. So we've all got something to do. It's not one big pot of money, and it won't all happen overnight. Somebody says, you know, we're not Mary Poppins. We just haven't got that money, but we are making some change and making some waves.
Yes.
Like with the is there like one common problem in education is that like something like to solve like a mental problem with something is like built around like around neurotypical, and so when it gets like implemented on someone who's neurodivergent, it just fails over and over again. So to what consent, will that problem be reduced through this plan?
So I think this is what you're describing is central to this plan. It's about saying actually there isn't one solution for everybody. We heard so much of that around education. When we were talking to people about education during the development of the strategy, people talked about actually sometimes the way in which my child is being taught or being supported in a classroom just hasn't worked, to the extent sometimes that people had taken their children out of education because they really felt that they couldn't make it work. So you are absolutely right. This is about saying, okay, that just doing one thing for everybody is not going to work. What do we need to do for individuals that will allow it to work for them? And that's a bit of a change, isn't it? That's a different way of working and has lots of implications. But that's what this is about. It's exactly that. Thank you.
Will you be looking at improving the way that social security views neurodivergent people? Because I've experienced myself when I've gone to like my LTIA reviews that they're quite dismissive of ADHD.
Yeah.
Is that going to change?
Yeah. So that's part of the making public services more accessible, isn't it? It's in there as one of the priorities. We've heard lots and lots of people's experience around difficulties around medical assessments, for example, where actually, they've been asked about, can you walk down the road and stuff? Well, that's not the issue here, is it? I'm not here because I've got bad legs, So yes, is the answer.
Like recognising that you can go through periods where you're more well and then you can become unwell, and for the doctor to actually recognise it. Because I've had I see Dr. Engelbrecht privately, and she wrote a whole letter for my review, and when I went to go to the review, it was immediately dismissed. So that was one of my questions. And then the other thing was in terms of like in prisons and schools and when you go through a crisis, are you looking at people's sensory needs to try and reduce the meltdowns that people have? Because I think that's a big thing.
Do you want to say anything about that?
Yeah, definitely in those environments, like I said earlier on, it's challenging because it is a prison environment.
Yeah.
But there are things that can be done,
Small
sometimes little things. Should be wearing ear defenders, there's a lot of noise, taking into account different learning styles and techniques, how people are engaged with and what kind of support they need. And at the prison, they have personal officers. It's like a buddy system, so you've got somebody there that actually supports and guides you through your journey through prison, where no matter how long or how short that sentence might actually be, but it takes into account all of those things that's going to hopefully mean that somebody comes out the other side and they can actually feel that they're a part of society, that they can contribute. Because any single one of us can make a mistake and end up in prison. There are many affluent captains of industry within the prison system. So it's making sure that people have got the right tools and the right support to give those better outcomes, that they come back in the community and stay out of that criminal justice system.
I think as well, Alice, one of the things that we're kind of trying to talk about all the time in all services is tell us what you need.
Yeah, like small, I'm thinking like very small things that don't cost a lot of money, like earplugs for when they go to sleep, because I know that they might wake up very easily, and then that's going to affect their behaviour the next day. They might,
You're the expert on that.
This is very small.
Curious and ask.
Yeah.
And often the most simple things of being curious and asking you what you need is missed. And I think we need to almost not over sort of exaggerate X, Y, and Z is what we need to do. We just need to be really good at communicating and being curious. And we said a lot about that in terms of behaviours that may be perceived as challenging, and behaviour is communication, and we need to be really cute at asking and inquiring why people do certain things in a certain way, and that's something we can definitely aspire to.
Yeah.
Really good question, thank you. Yes.
I was just moving on from that. Clearly you have first aid, so work on mental health first aid. Could you not, sounds a bit weird, but like ADHD is a
Yes,
word.
champion.
You know, is it champion? So
Yeah.
say, oh, in the hospital, I can work with patients who have ADHD. Actually, if someone's overwhelmed because I have ADHD, I might not have their feelings started at the time, but I might know a little bit.
Yeah.
And to help them, what do you need, what do you want me to do, what will help you right now, which some people might not get.
Yeah.
Same in schools,
Yeah.
teachers,
Absolutely.
anywhere with people with autism, because I wouldn't know what it's
Yeah.
like to feel
Yeah.
how, you know,
Yeah.
so we could help support us.
That was a really, really good point. And,
You sound as if you're going for a working party.
Yeah, you are.
I can see a couple of candidates in here already.
I'm just trying to get you quick fixes that would.
Yeah, no, and absolutely, but that creates the momentum and that creates the community, doesn't it? It's not about services must do X, Y, and Z. It's, you know, everybody's responsibility to be tuned into different people's needs, you know, and how to support people in your workplace and in your schools and in your, you know, in your prison service and in, you know.
So,
Assumpta
we're going to had a hand up. We're going to wind this bit up in 5 minutes, folks. So if you've got questions left, do indicate now. Assumpta.
Yeah, another question for you, Andy. It's actually for Chris. I'm just thinking about, you know, evidence of good practice and how we can evidence perhaps in year 1, 2 and 3 that things are happening. Autism Jersey has advanced accreditation and has held it for a few years. Surely you can be a major influence with services and businesses and that to maybe demonstrate good practice and get them accredited.
Yeah, I think that's absolutely right. I mean, you know, thanks for raising that, because we're really proud of that accreditation, and it just shows the quality of the work that's being delivered today from Autism Jersey. And I think within that, you're right, there's something about how we share those experiences together. And I think the beauty of this strategy is the fact that we're in a stronger place today at working in partnership, especially with our government colleagues. You know, there's a fabulous example of the work that we're currently doing around pre and post diagnostic support, because there's the gap that was evolved out of with the limited resources that the government services had. And actually we've been able to put resources in, so back to the money bit, which wasn't just about us saying give us some money, and he did give us some money, but we also contributed. And I think in that working together, I think we can, and what we realise is there are pieces of work that we're doing today that would definitely benefit some of our other colleagues, it would definitely benefit our friends in the ADHD services. And we can share that. We can share that. And what we would want to do is encourage other services to go for accreditation. Because again, a few years ago, there were other services that were accredited, but today we are the only ones that are accredited. So I think, you know, we can definitely share that.
Okay, so I'll take the lady and then the gentleman, if that's okay. Yeah.
I'm here actually representing the Jersey Association of Home Educators, and I've heard home education mentioned a few times throughout this evening, which is wonderful. I'm just wondering, my question is very simple. How do we fit into this in terms of obviously the education priorities that you've outlined, but also I think that perhaps more far-reaching for home educators who would probably touch upon some various priorities.
Yeah.
So I just wondered what your thought process has been around that.
Yeah. So clearly, within the education piece, there's a big bit of work for you to do, I think. And we need to make sure that you're engaged in it. So that's the obvious answer. But I do come back to what I said earlier, which is that we have to just make sure that we've got a read across these priorities and that we don't end up with siloed bits of work. So one of the things that the Oversight Implementation Board will do is keep looking at that and keep looking at, but then you need to tell us. So if it feels like, as we're implementing, that it is a bit siloed and it's not linking up together, and there's particularly, if you've got ideas about why don't you do this, you could do this differently, please just tell us, because this is an iterative process, and you know, it will grow as it goes, frankly, and the priorities might shift a bit. You know, something might happen and we might say, actually no, next year we need to do this rather than that, because people might tell us that's what we need to do. We want to keep with that. These priorities have been developed because that's what people have told us they wanted to prioritise. let's keep that in the work thing. So hopefully we'll have you on board. That's the.
Thank you. And if the focus can also be not necessarily about transition back into a school environment, but more so for children who are going to be continually educated, whether they came out of school originally or philosophically families have made that decision to take a different pathway of education. It would be great to keep the focus on that too.
Thank you very much. So I'm going to take the gentleman behind you, then I'm going to take Jane, and then we really are going to wind up. So
thank you. Just to pick up on the comments you made about building an army of supporters, and the lady on my right who was talking about advocates for people who are neurodivergent, autistic, whatever. One of the things that I see is that neurodivergent people, whether in my family or at work, generally aren't good advocates for themselves and are very easily fobbed off by the system or people who want to get rid of the problem and don't advocate for themselves, don't fight for themselves. When they can't get ADHD medicine because the doctor isn't available, they just walk away empty-handed. And actually, I'm sure there are many of us here and elsewhere who could potentially help people in those situations and be available to say, I'll come with you, I will sit with you, I won't let you leave empty-handed. And perhaps that's something that we could think about amongst ourselves, expanding, building up a register who might be able to help. Because too often I see someone who's in need, who has a really serious need, come away empty-handed saying, oh, well, they said they haven't got it or they can't do it or whatever. But I'm sure many of us here, if they were sitting there in conversation, would get a different outcome.
I think it's a great idea and a brilliant offer, and I think we need to think about how do we make it work. It sounds exactly like the sort of thing that we want to develop, actually. And I have to say, having had a number of people with lived experience around the table in the development of this strategy, some people are very good at representing themselves and actually challenging us quite a lot about some of the stuff that we were putting in, not putting in, prioritising, not prioritising. But you're right, it is about collective, isn't it? If there's one thing about Jersey that we really need to max out, it's about making the best of that community. And I don't think we do it all the time. That sounds like an example that really would do it. So thank you for that. Jane.
Yeah, I just want to respond to the homeschooling, because education is my area of expertise. I think homeschooling got such an important role to play, and it's also not to say that they'll be homeschooled forever, but there also can be some that need periods of homeschooling. So it's also thinking about how to really reach out to those children who are a bit in between, who need some, but also do want to transition. So there's also that link about how do we work together with the mainstream education, because I think mainstream can also learn a lot from homeschooling because it comes at it from a different perspective, probably more student-centered, probably more one-to-one. And I think mainstream education can learn a lot about that model of teaching. And so I see more of a collaboration between homeschooling and mainstream and how you can work together. Because I think this is what this strategy is going to be about. There's lots of skills and talented people on island with exceptional skills and knowledge, but it's like, how can we bring that together in the sense of community that Andy is speaking about? And it also ties in with the peer support, supporting people to access, mental health services, AD. The system, healthcare is, it's a milestone to access for people who are not inside it. You look at this big institution, it's like a monster. And then you walk in and then, somebody tells you, oh, well, we're not going to help you now. Come back, and how do you deal with those scenarios? And you're absolutely right. Sometimes being with here and being in a collective, in a group, it could even be 3 of you. You sometimes do get a better answer that way. So it's thinking about all of those things, I think it's a whole bundle. And congratulations to Liz and Leslie. Well done for being great. And Andy supporting the.
Not at all.
Thank you very much.
This is very much a collective effort and a collective enterprise, I think. But thank you. So, to finish us off, I think we're going to hear a few words from Nick Hutchinson from Autism Jersey. Thank you, Nick.
Thanks. Right, good evening everybody. You'll be pleased to know I'm the last speaker and you can all get out of here pretty quickly, I think. I want to do two things. I want to offer some formal appreciation and thanks to the people who have put this strategy together, and then just leave you a few personal thoughts about how I see it rolling out. So if I just go through a list of people that I want to thank, and if we get to the end, if we have a round of applause, that's the most efficient way of doing it, I think. So I offer thanks to the Minister, Tom, who sadly can't be here today, Deputy Andy, who's stepped in to cover for him, our Director, Andy, who's done a great job in it. The steering group, they're all listed in the document. The admin support, the people who have done legwork behind putting this paperwork together, they're very important. Particular thanks to the project leads, Liz and Leslie here. I went to one of the workshops that was to my 5 penny worth. Amazing events. People really willing to share their life experiences, their frustrations, their hopes for their future, and their willingness to get involved. I should thank the museum staff for making this work, and the food and the drinks. But most of all, I think the biggest thanks goes to everybody who's contributed to putting this together. So the people who bothered to respond to the questionnaire, the people who came to the workshops, the people who have had their say. It's not the end of it. There's still time to do that. And I think it's just a round of applause for everybody, please. For Thank you. Now, we need to be realistic about how this strategy is going to pan out. We've all seen strategies run into the sand and then just disappear, quietly fall away. There's a couple of features here that I'm putting some faith in. One is the annual review that Andy's talked about, which is presumably, I don't know, every November or something, we'll get a steer as to how things are going. We'll get metrics, we'll get measurements, and we can challenge. The other, and then perhaps more importantly, is the Neurodivergent Advisory Board that Liz told us about. If that's an effective board, it's live, it's active, and it has a voice, then they're going to sense check everything that's going, they're going to steer everything that's going, and that's going to be a great advantage. I put a lot of faith in that. Now, there will be difficulties. Now, people that know me will know I always like a good quote. So tonight I've gone to my regular sage, Mike Tyson, the former boxer and heavyweight champion of the world. Now, when told by a reporter that his next opponent had a plan as to how to beat him, he said, everybody's got a plan till they get a punch in the face. So we're going to get metaphorical punch in the face. We're going to meet obstacles. We're going to meet difficulties. And the trick is we don't give up. We don't walk away. We don't say, that's the too difficult box. We were being over-ambitious. We're not. I've looked at this plan. It's not over-ambitious. It's actually on the money, right on the money. So we don't give up. We regroup. We start again. We find another way. The other element that I see affecting us is time. And I see that time in two ways. One is that some of these actions will develop over the years, and I think Andy referred to it before. Some of these actions you're going to see positive outcomes in year 3, but year 1 and year 2 are putting the structures into place, training people, finding the right people. So it doesn't all happen at the same time, and not all these priorities will develop at different speeds. They'll all be going in the right direction, but they'll be going at different paces. Some of them will whiz along, some of them won't. And the other time element comes from the collaboration. Now, collaboration has a downside. It can make it look like everything's going really slow. You're sitting on the outside and you're saying, for goodness sake, why don't they just get on with it? But it takes time for everybody to have their say, and it takes time to bring everybody on board. The upside of collaboration is once you've got everybody on board, you've got a wider buy-in. You've got an efficient, effective use of resources, and you've got a more sustainable outcome. Now, this document here, as we all know, Government of Jersey, Autism Jersey, we were the founders, we kicked this off, but it wasn't us who developed it. There were many, many people got involved in this. And I think the thing, I'm proud that Autism Jersey is associating its name with this and is behind it. But please understand, this strategy doesn't belong to the government, and it doesn't belong to Autism Jersey, it belongs to everybody. belongs to our community. Thank you. And to prove it, it's got its own logo, I believe, which is quite nice. So from today, this strategy starts a new life. It lives on its own. Strong communities thrive through sustained effort and cooperation, and we all know that working together multiplies the impact of our initiatives. It takes vision to see possibilities, it takes courage to step forward and take action, and it takes heart to bring people together and work towards common goals. So tonight, please, I urge you to be part of this strategy, join in on the future. And with that, I formally close the launch. Thank you all for your attendance and wish you safe journey home.